The pregnancy glucose test, that's what we're talking about today. What is it? Why are you supposed to take it? Do you really have to take it? Are there alternatives if you want to test for the same thing without doing the disgusting sugary drink thing that the doctors have you chug down at the office? That's what we're talking about today. So stick around if you are pregnant and facing potentially taking the glucose test. Hi, my name is Rachel Moises from the Mighty Mama Movement. I'm a mother of 8 and I'm here with Heather Shelley.
And I am a family nurse practitioner and midwife.
Heather is our in-house expert on all things medical. And so I'm going to be asking her some questions so that she can educate all of us. So to begin with, what is the glucose test and why do we have to take it anyway?
Okay, so the glucose tolerance test is done in pregnancy because we become insulin resistant, and we don't handle our blood sugar levels very well, the processing of sugar and everything that pertains to kind of that diabetic state. And so we do 50 grams of sugar, kind of a loading dose of sugar, and then your blood is taken an hour later and they test, okay, what are your blood sugar levels then? And if they're over 140, then it defaults to a second test. And that one you would take 100 grams of sugar. So you would fast. They would take your blood sugar levels, see what your fasting level is in the morning. And we want that under 100. And then they would draw your blood at 1 hour, 2, and 3 hours. So it's kind of a lot of pokes that you get there. And they want to see over those 3 hours, what are your blood sugar levels? And if they're high, then you have gestational diabetes. And if you have at least under 2 of them, or if you pass all of them, then you're fine. So if you fail 2 of those 4, you have gestational diabetes. And that's what we're looking for.
Okay, so we're trying to see how our body can handle sugar during pregnancy.
Right.
In what sounds like pretty high doses.
Right.
Okay.
Exactly.
And so you said it's the initial test is 50 grams of sugar. So
Right.
I've actually never done one of these glucose tests, 8 pregnancies, and I never have done one. But I've heard that they're kind of unpleasant. What is the typical glucose test like?
So they typically use something called glucola or a glucola drink. It is like drinking the syrup of Sprite or the syrup of Crush soda. Very concentrated, kind of ooky. It honestly makes a lot of people kind of sick when they
I can see why.
take it. Yeah.
Sounds really gross.
So when I took it with my first baby, my doctor had me eat a king size Snicker bar. And that's how he did it. So you can use something called the Fresh Test, and that's the brand name of it. It doesn't have the dyes and kind of that artificial coloring and everything, because that's what a lot of women don't like, is the syntheticness of the glucola drink with the dyes and the kind of sugars that they use. Mm-hmm. They're like, I wouldn't drink this regularly. Why am I drinking this now? Okay. I personally have, moms can do the Fresh Test, or they can do like a smoothie drink, like an Odwalla naked juice, something like that. Anything that has 50 grams of sugar for 1 serving is what I have them use.
Okay, and so if they were to do like a juice, how quickly do you have to drink that? Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dialing to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learned these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you'll be so glad you did.
Anything that has 50 grams of sugar for one serving is what I have them use.
Okay, and so if they were to do like a juice, how quickly do you have to drink that?
In about 10 minutes.
So if I'm pregnant and my doctor tells me you have to do the glucose test, is it very typical to get pushback if I say, hey, I do not want to do that sugary drink thing that you have, so I'd rather get another form of 50 grams of sugar? Like, can they expect pushback, or most doctors going to be like, oh, sure, as long as it's 50 grams of sugar?
That depends on the doctor. You're going to have some doctors that are like, we glucola, that's all there is to it. That's all you can use. And that's where you have to bring them research about, for instance, the fresh test, that, hey, this is an approved drink that you can use. It's actually a powder that you add to water and drink. And you have to be like, hey, this is approved by ACOG. This can be used. And like I said, some doctors, like my first one, were like, just 50 grams of sugar, Snickers candy bar works for us.
So if you wanted to do the fresh test, how would you order it? Does your doctor order that for you?
Some doctors will have it in their office. We carry it in our office for moms. It's about $20 to buy that. And you can also order it online. Fresh test, you can order it straight from them.
Okay.
Yeah.
So am I correct in assuming that if a doctor says, no, we want you to do the glucola test, but a mom says, well, I'm not drinking that, I'm doing the fresh test, so you can want that all you want, I'm not doing it, that's within her rights, isn't it?
Absolutely is, yeah.
Okay.
And then I have some moms who are like, I don't want to do any of this. Maybe they're terrified of needles. They've done it in past pregnancies and they're like, I feel like crap when this happens. I passed the test fine. I'm not worried. Then in my practice, I obviously give them the right to refuse. That is always their right. I'm not going to say, well, you can't give birth with me. Like, they have that right. But another option that I give people is to either use a continuous glucose monitor, you know, the ones that go in the back of your arm, or they can do the finger prick test 4 times a day, you know, just that little lancet. And they just buy like the little glucose thing off of the internet or, you know, a drugstore, that kind of thing. And what they do is they would take their blood sugar levels every morning. And I personally like the continuous glucose monitor on the back of the arm because it's easy peasy. It just connects to your phone. You can see everything in real time. There's no finger pricks needed.
Do you have to remember to test at certain times a day, or does it all automated?
It automatically does it, but you can do you can push a test, meaning that you can make it test right at that moment for you.
Okay.
And so what you do is first thing in the morning, you look at what your blood sugar levels are. When you wake up, they should be under 100. And then you do it an hour after every meal. So just set an alarm, and that way you can do a push test on the phone or prick your finger. And that should be under 140, preferably closer to 120 an hour after the meal. If it's over 140, you test it 2 hours after the meal, and that should be under 120.
Okay, and you do that for how many days?
I usually have moms do it for about 2 weeks.
Okay.
And that's how long the continuous glucose monitor lasts, as well as 2 weeks before you have to replace it.
So if you were to do this option, you'd get let's just say the monitor, because that sounds way easier. And then like it makes a report that you'd give to your healthcare provider to look at, or you just look at it yourself? How does it work?
On your phone, it would give a report on your phone, and you can usually you can email that report to the provider. I just have moms show me their phone, and I look at it, and I can go through the numbers and make sure everything is okay.
So the point is just to make sure that after your meals, your body is managing its blood sugar on its own like it should be.
Exactly.
And if it is, then you're fine.
Good to go.
No problem.
Yep. And and if their numbers were kind of borderline, a lot of times I'll encourage them to continue this, or I will have them redo it again, let's say at around 34 weeks, just to make sure everything is still on the up and up. If they failed it, they're going to keep that monitor in the whole time, and hopefully they can keep their blood sugar levels under control with diet. If they can't keep them under control with diet, then we need to go to insulin. So, and the reason that we want to keep their blood sugar is under control is because it can have a baby that's larger than the mom could deliver. So, and that happens because babies are used to this constant flow of sugar. And when they're born, the risk is baby can actually go hypoglycemic, because once you cut that cord, baby's not getting that constant flow of sugar, and the baby will go hypoglycemic. And so then we have to watch the baby after it's born as well.
Okay, so I just want to make sure I understand. So because if mom's blood sugar levels were too high because her body is not managing that properly,
Right.
then that means baby's blood sugar levels are too high.
Right.
Then when they're born, they're having a problem because they're used to the higher levels of blood sugar. Okay, that makes sense.
Yeah.
And are there any other risk factors with like high blood sugar
So
during pregnancy?
mom is much more likely to develop type 2 diabetes in the next 5 years than if she didn't have gestational diabetes. And so it is an indicator for her to look at her lifestyle and change that lifestyle, or to or continue to be monitored quite every year to make sure she's not developing type 2 diabetes, because that is a definite possibility for her to develop type 2 diabetes.
Okay. So what about the mom who says, well, I don't want to do anything. Like, I don't think I have type 2 diabetes.
Right.
Is there any way she can sort of, I don't know, evaluate her risk or the necessity of whether or not she should have to do any of this? I mean, it sounds like it's a good idea to do it.
Right.
But just saying, I know there's some women.
Right. No, exactly.
I don't want to.
I look at it on a case-by-case basis, because once again, every mom has the right to refuse. And if she refuses, we're going to kind of go over some guidelines. Some people will say, oh, well, I'll just look for warning signs. There's not really any warning signs until you are very severe. There just isn't. So I would recommend that mom have a hemoglobin A1C done on her blood work. And I do that for most women with their initial blood work anyway, is a hemoglobin A1C. And if I have a mom that comes back with a low hemoglobin A1C, she's much less likely to develop gestational diabetes than a mom who has pre-diabetes or, of course, type 2 diabetes. And that way I can kind of monitor it that way. And then we go over diet. Are you getting at least 100 grams of protein every day? I tell moms, cut out grains, not carbs, because a carrot has carbs.
Right.
An apple has carbs. But grains and starches, which are potatoes, rice, pasta, bread, just cut them out. I don't even want them to go to like whole grains. Just cut out grains out of your diet. And
that is a really big ask.
It is.
For me.
But when I tell them to cut out grains, they'll probably cut out about 80% of their grains.
Right.
They won't, very rarely do they do it 100%. But it is really important that they really, really limit their grains. And once again, I don't say carbs, because there are good foods that have carbohydrates, but we really don't need grains unless you are someone that is a runner or high exerciser. We just don't need them.
So if there's a mom who says, doctor, midwife, I really want to decline the glucose test in any form, what things, you said hemoglobin A1C, that's one thing that they can look for. Anything else that they can look for to kind of say, hey, I really don't think I'm at risk of it because look at what my initial blood test said, or any other, or they could say my diet doesn't put me at risk. Is there anything else that?
I think just making sure that they understand why we're testing for it and what can happen if it is developed or undetected. And it's not just someone that is overweight or someone that is underweight or someone that is average weight. Anyone can develop this. There are people who are more prone to it. So I want to look at their diet then. Okay, show me for the next 2 weeks, I want you to keep a food diary. Let's look at that food diary, because it's not about starving someone. A pregnant woman should never be hungry, but it's what are you putting in your mouth and how much and how often. And I can help them by looking at that food diary and saying, okay, let's cut this out. Let me give you an example. I had a woman who her A1C came back quite high. She was type 2 diabetic, undiagnosed. And so we had her start monitoring her blood sugar levels until we could get her into neonat or perinatology so that she could get more help because her levels were so high. And so I had her keep a food diary, and she brought the food diary in one day, and for lunch she had 2 peanut butter sandwiches. That's 4 pieces of bread. And I was like, you can't have 4 pieces of bread for lunch. Like, I know peanut butter is a good protein for you, but you're either putting honey, which is a high glycemic index sweet thing on there, or jam, which is also a high glycemic index. And definitely those 4 pieces of bread. And she's like, but I'm hungry. And I'm like, I understand that, but we have to find higher
Other
protein
foods.
levels. You absolutely cannot eat 4 pieces of bread for lunch. You know, you can't have oatmeal, or because people think, oh, oatmeal's great. Oatmeal is a grain and it's pure sugar. And we all know that we're sweetening oatmeal with brown sugar, maple syrup, something, honey, and milk, which is lactose, which is pure sugar. And so you can't have cereals for breakfast, hot or cold. Really, it needs to be things like an omelet, eggs, anything that's just high protein. You can't do. Maybe it's a green smoothie with some protein powder in it, but you really have to change the way you eat. Once again, you should never be hungry, but you have to change the way you eat.
Are you saying this is for people who, test positive for gestational diabetes, or generally speaking, probably all pregnant women should try to
Definitely.
adjust their diet a bit?
I would say all pregnant women should adjust it, but definitely those with gestational diabetes or those who don't want to test. We kind of would, because they say, well, what happens if I test positive? I'm like, well, first we're going to look at diet and how many carbohydrates and grams of sugar you're getting a day. And they say, well, I'll just do that instead. I'm like,
Okay.
great. Okay. That's something we can do.
Okay, that makes sense. So either way, it's not something you want to just completely ignore and be like, well,
Right.
I'm not going to do anything about this, because there are some risks involved. And like you said, you can't really see symptoms
Right.
until it gets very serious. So
Right.
either do the test that they have, do an alternative test,
Right.
or at least do the food monitoring and what you're saying, just have your healthcare provider look at your health history and your different
Exactly.
options and see. Have you had times where you've had to tell a mom who wanted to refuse that based on what you're seeing, you really, really, really strongly recommend she does do the testing?
Definitely. Those are, I have to really emphasize to her that these are the risk factors and this is what I'm seeing. And honestly, I haven't had anyone refuse it that I said, hey, I think you have these risk factors. We need to look at that. I have had women that I had to transfer out of care because their blood results did come up high and they were not willing or able, one or the other, to control their diet enough to be able to stay in my care.
Okay. And why is that they had to be transferred?
They had to go to perinatology because their blood sugar levels were just too high and they couldn't keep them down at all, even with insulin. And when we're doing those high levels of insulin, and that insulin can be very finicky, very picky, you have to be very precise. And where they did not have the ability to control that on their own, they needed that higher level of care.
Oh, okay.
Yeah.
All right, that makes sense.
Because of the risk it plays to baby.
Right.
It's not just about mom. It is about the placenta, and not just having a 10-pound baby, because some women can deliver a 10-pound baby, no problem. But I always tell people, you will grow the baby that you can birth as long as there's no inhibiting factors like gestational diabetes, type 2 diabetes, a broken pelvis from a car accident or something. You will grow the baby. And so you are now growing a baby that you may not be able to birth, but you're also looking at inhibiting the placenta, the blood flow, the nutrition flow through the placenta, and you're endangering that baby that when it's born, its sugars are going to crash, and it has to be watched very, very closely.
Okay, so we touched on this, not having too high of carb intake and grain intake, but let's go a little bit deeper into diet and lifestyle changes that any pregnant mom can make to reduce her risk or to manage the risk of, side effects and bad outcomes from having too high. So this is for any mom, whether she is trying to avoid this issue or she already has been diagnosed with high blood sugar during pregnancy. What are some lifestyle changes that she should make?
So we talked a bit about, cutting as many carbs or more grains from the diet, but pairing them up together is really important. So let's say you're eating an apple. You want to have protein with that apple. The protein will help sustain that sugar and not just have it kind of rush in and rush out and cause that sugar crash. So peanut butter with an apple, cheese with an apple, cream cheese, even cheddar cheese, whatever cheese you like. But taking a protein and pairing it with that carbohydrate can make a big difference. When you're looking at maybe you're having some nuts or whatever it is, just say, okay, if I'm having this, what is something that will balance it or slow the digestion of this? For instance, warm bread. Love fresh baked warm bread, right? But that is an absolute sugar rush. Absolute. Doesn't matter if it's whole wheat. It is still a sugar rush because it's warm. So allowing that bread to cool down is beneficial. Same with rice. Hot rice, allowing it to cool down. Adding butter to it. Butter is a fat, and butter will help the process of the body metabolizing that warm, hopefully not warm, even though it tastes really good.
I'd way rather have it warm with some butter and some protein.
Right.
If that's an option, I'm going with that one.
But balancing them that way can really make a difference. Yeah.
Okay, so actually, this is what I do anyway. I'm not pregnant, but it's actually a really good nutritional advice for even when the pregnancy is over, because any human wants to avoid sugar spikes,
right?
Glucose spikes, because they have long-term damaging effects on your health. So good tip all around, and I try to practice that and try to get my kids to practice that whenever they want some. Like, that is just carbs. What's your protein? Like, like, you need to find some protein with that.
Yeah.
But okay, so lowering grains, pairing with protein, just generally eating more vegetables and protein than whatever source of carbs you're getting.
Well, like, let's take apples and carrots. If you juice an apple and carrot, you're taking out all the fiber, which also helps with slowing the absorption of the carbohydrate, the sugar. And so it is much better to eat a carrot than it is to juice a carrot. Now, if I have the choice between carrot and a soda, carrot juice and a soda, I'll take the carrot juice over the soda. But if I have a choice between carrot juice and a carrot, choose the carrot because of the fiber that's in there.
Okay. And what role does exercise play in managing blood sugar levels?
It can really, really help, because then we are using the sugars up and we're not trying to convert and store them or having them float around our blood freely. So one thing I tell women is, especially as your stomach, gets squished by the uterus, is first always start your meal with the more nutritious food. And if there's any room left, then you can have that little bit of cake or that cookie. But to take it a step further, if you're willing to take a walk. So if you think, I am too tired tonight to take a walk, then skip the dessert. If you can take a walk, then you can have dessert and go take an hour-long walk, because then you are helping to burn off some of those sugars. But if you just say, I am too exhausted, my feet are swollen, I can't walk, then skip the dessert.
Okay. Okay, that makes a lot of sense with just you having the sugar in your system. If you use it, much less effect than if you're just letting it sit in your system.
Exactly.
I've had to do that with I have some teenage boys, and it's really hard to keep them fed without sometimes getting things that are a little bit high in sugar, just because so many granola bars, they're not actually healthy. They have a ton of added sugar, but at the same time, I can't starve them, and sometimes they just need something to grab. But I decided, okay, fine, we'll make a few exceptions because you're so active, it's probably okay.
Right, exactly. Another thing to look for is kind of the opposite, is hypoglycemia. And women can experience that because of the insulin resistance. And signs of hypoglycemia, meaning low blood sugars, are tingling lips, shaky hands, or tingling hands. You can have a lot of those kind of, you feel lightheaded, you feel like you might pass out, you can't concentrate, and like I said, tingly lips and fingers and stuff like that. You can't use your hands as well, your coordination. Those can be signs of hypoglycemia as well.
In which case you just need to eat something, I'm assuming.
Right. And typically someone will start with, let's say, a little bit of orange juice because it gives them that quick sugar, but you still need to balance it with protein. Otherwise you will just crash again. And so you need that protein to help level it out.
I want to talk a little bit about the emotional side for women who do end up testing high and getting, diagnosed with gestational diabetes, because we've been talking a lot about how eating healthy and exercising can help lower your risk, or if you do get it, it can lower the symptoms and the problems it gives you. But I believe it's also true that you can still get it no matter how healthy you are and no matter what your diet is and how healthy you're eating. So I don't want to give the impression that this is completely in your control. There are things that you can do to lower the risk and lower the symptoms, but it doesn't mean that every woman can just avoid gestational diabetes by lifestyle changes. Is that right?
Correct.
Okay. So don't feel bad if you do get it. I mean, basically that's all I'm saying. Like, don't feel like, oh, I haven't been taking care of myself well enough, and so it's my fault because of my baby. And honestly, coming out of the first trimester, there's also the problem of sometimes you had to just eat whatever you could keep down and you were in survival mode. And then you do this test in the second trimester, right?
24 to 28 weeks. So yeah. So
maybe it's just hard because you were in survival mode and like, well, I got to eat whatever I can keep down, whatever I can find. You don't have an appetite. Sometimes not everyone has that problem, and now you are going to end up, if you end up with gestational diabetes, again, it can just make you feel bad, and don't feel bad. If you do have it, maybe you want to make some lifestyle changes, or maybe you're going to say, nope, I don't need to make lifestyle changes. Like, actually, I'm totally fine. I just got it because I did. Are some women more prone to getting it for, I don't know, genetic reasons or something?
Definitely genetic reasons and their health history in general. But, if someone says, my sisters all got this, my mom had this, chances are she's going to have it too. And that goes to the whole thing. Okay, is it the way we were raised or is it our genetics?
Yeah.
Not sure which one it is. But if you do have a familial history of it, you have a better, I don't say better chance, but a higher chance of getting it. Okay. So yeah, you'll want to be careful there. And then remember, it can develop into type 2 diabetes after the baby is born. So you do have to be cautious of that.
Right. So you don't have to feel bad about it, but don't ignore the warning signs. All right. We hope that has helped you make a decision on how you want to handle your glucose test and understand why you need to take it, and any alternatives if you're not exactly wanting to take the glucose test that most doctors do. Don't forget that if you're pregnant and wanting to have a low pain birth, we have a free birth class called How to Give Birth with Practically No Pain that's linked below this video. And like and subscribe so that you can keep watching all the educational content that we're going to be putting out.